We came to know about little Annie when she comes to the hospital for a blood transfusion. She has a genetic disorder called thalassemia major. As time goes by, her mother left her. Her visit to the hospital has increased, but the number of people who follow her has dwindled down to one. It's quite a sight when she comes in the evening, tall little man with a small little sickly child. Eventually, her father also left her. Was living alone with her grandmother in a one-room flat. She gave the bed to the grandma, and she slept along the bench and she fell repeatedly. On their own accord, the sisters, they bought her a sofa bed. We make sure that when she comes at A&E, the doctor will see her. We bring her to the special ward whereby she's familiar with all the nurses and doctors, and even the porter. The porter will make sure that she has special food and whatsoever. When they needs the lab, she needs blood, absolutely no worry. We grew up with her. We grew up with her pain. We also grew up with her joy. Till the rightful age of 29 years old. For the first time in my life, we've seen people of so many levels coming in together to make life better. Everyone adopted her as our child. We make sure she's more than a patient. We give her a life that she deserves.
John is one of the many inspiring patients that I've looked after. Perhaps not so much taking care of him, but merely being a friend. He worked all his life as a private Mandarin tutor, bringing up 4 lovely children. When he came to me, he has cancer already spread to the bone. Despite all his discomfort, he's always very upbeat. He always said, I can eat, I can go to the toilet, and if I can still go to the park, I'm satisfied. One of the last clinic visit, and he was not quite his usual cheerful self. As it turned out, the family has decided that perhaps it's too tiring and he might hurt himself going to the park. I urged the family to consider perhaps we lend him one of our wheelchairs and he can go to the park and still do his daily walks. So despite much protest, the family obliged. To heal sometimes, to relieve often, and to comfort always is something that I've been taught. To serve him is already a privilege. To let his courage really bring out the best in all of us, how precious is that? When I came to the office in the morning, I found a beautiful orchid sitting on my desk, and it was early morning, the sun was shining through. And the company note was a thank you note from the family. John has passed on. He has wished to share a little of the park. Now the desktop screensaver reminds me every day of this very brave individual who has faced illness and death really with grace and courage.
His name is David. Yeah, he's in his 20s. Young chap with a very bright future. I would say it was really a freak industrial accident. He actually came in to the ICU. Our first reaction in the ICU was to give him as much support as he required and try to get him over the critical period. It's going to be a long journey. There's a lot of encouragement from us and even from his family. They actually stay by his bedside. Every single day, every single hour, there'll be somebody there 24/7. Yeah, even though we know that the family is already very tired out. We save him, he'll recover, then infection sets in. So it was a phase like this back and forth a few times. And a lot of times, we'll reach to a point where medical support is there, is whether the patient is able to pull through that period or not. We really do not want to give up hope. He wants to see a future, even though it's like a bleak. And he thinks that there's so much more that he can do and that he can contribute back to the society. He's very depressed, because he cannot even walk at all. We told him, that we will take him for a walk. It just happened that he was able to view his house from that place. The view was magnificent. Even though it's just that small gesture, he really enjoyed it. Physiotherapists and the occupational therapists helped a lot in his recovery process as well. The exercises that the physiotherapists provided for him, he will stick on his wall, his room wall, so that on and off he can see what exercises he's supposed to do. I just helped him and then encourage him because he's not just a patient to me anymore by then. He was like a friend, like a little brother. The magical moment actually came when he took away his walking frame, and he was able to make his first few steps by himself. That was really amazing.
Everybody goes beyond the call of duties to provide the best possible care. And when we see the joy that the receiver receives, actually the joy is double on us. By working through NA, I think all of us will cultivate, will enhance our ability to empathize and to provide care with compassion.
To treat him as a person with disease according to the rules, according to what is evidence-based medicine without regard to his wishes would be a mistake. So we oblige him by letting him do something that is important to him. I think he exemplified that perhaps my life as a patient, as a person, is not defined by my illness and my pain. I think the pot of orchid on my table was affirmation that perhaps that connection with the human being inside him was something precious and that he valued.
This is a part of the many patients that I've encountered that make me very passionate about what I want to do. And I know how important it is to work as a team, because it's never a lone effort, and teamwork is very important, in such cases. And we have to ensure that the patient is safe in our hands, one, and then secondly is that the family trusts their loved ones in our hand. And it's not through words, but by actions.